Well, I'm here today with Matt from High-Tech Laser. We're going to talk to you about the Monalisa Touch, which is a laser treatment for vaginal regeneration. So thank you for taking the time today, Matt. Can you tell us a little bit about it?
Well, Monalisa Touch is a new treatment for symptoms related to vaginal atrophy, things that many women will experience in their life, more than 50% of women. It's symptoms that are often related to menopause, but not necessarily only for women going through menopause and after menopause. So the most common symptoms that we're treating are dryness, so vaginal dryness. And that can be caused by menopause and a thinning of the vaginal wall, but also women that are breastfeeding after pregnancy, when they've given birth, they can often get vaginal dryness because of the changes in their hormones during the period of breastfeeding. And that can lead to painful intercourse, which is probably the other most common symptom that we're treating. So it's called Dyspareunia, but the common term is painful intercourse. And then some other things like vaginal laxity, itchiness and burning. And then some patients also report improvements in stress urinary incontinence or mild stress incontinence. And a few other symptoms as well, but primarily we're using it for dryness and painful intercourse.
Okay, great. So also I've known someone who's had really good success with it for they're having a bit of cough and have a bit of an accidental leakage. It's helped for that as well.
Yeah, so that's the stress incontinence. So the things like dryness and painful intercourse, there's very good published research showing the evidence and showing the level of improvement that we can get, and it's very consistent in that way. For stress incontinence, it's something where at the moment there isn't good published research, but many of the patients that are having treatment for other things, like dryness and intercourse, are also reporting that they see improvements in their mild stress incontinence as well.
Fantastic.
Yeah.
Well, if you want to know anything else about it, I'm a real advocate for this product because I've actually had the treatment myself, and it was actually a catalyst to help me fix something that I've had an issue with for over 20 years. So I know all about it, and there's plenty of gynaecologists and plastic surgeons around Australia that have got the device that are offering the treatments as well. So don't be frightened and don't think that there's not something out there. You don't have to actually put up with what you're probably putting up with, which is...
Yeah, well, that's an important point because many of these symptoms are things that previously have been difficult to treat.
Yeah.
So some patients use estrogen cream, and for some patients that works well. But for other patients, compliance is a problem because it's not very nice to have to use it. Also, some patients it doesn't work. And other patients, if they've previously had breast cancer, they're contraindicated. Most doctors would recommend that they don't have estrogen. One of the important things to remember is the treatment only takes a few minutes. For almost all patients, the treatment is painless or very mild discomfort at the most. Post-operatively, very little complications, if any. Most patients won't have any post-operative experience other than maybe a little bit of warmth for 12 to 24 hours afterwards. Some patients will have a little bit of spotting, but most patients really not any side effects afterwards at all. It's important to remember that patients need to plan on having 3 treatments. So 3 treatments 4 to 6 weeks apart is a typical protocol. And if the patients see a nice improvement through those 3 treatments, then they probably need to plan on having a treatment every year or so to maintain the improvement. So it's not a permanent improvement, but you need the 3 to really get up to a really high level of improvement, and then you can normally maintain it with a treatment every year or so. Everyone's a bit different, so some patients will need 2 treatments a year to maintain it, and others might need a treatment every 2 years. But the nice thing is because it's a minimally invasive treatment and so well tolerated by the patient that between the doctor and the patient, they can work out for themselves, between the two of them, when the right time is to have another treatment. Whether it's to have it to avoid the symptoms coming back, or whether they wait until the beginning of the symptoms and then go again. Also, it can be used in conjunction with estrogen cream. So some patients would use estrogen cream when the mild dryness starts to come back, and then have their Monalisa when the painful intercourse starts to come back. So they can manage it and combine the two to suit what they want to do, suit their lifestyle.
Okay. And from a personal point of view, I'm really scared of lasers because lasers actually hurt to me, but this is actually it was for me, totally pain-free, so it was actually quite mind-blowing.
Yeah, so the reason for that is the kind of laser energy, the way it's delivered, and in reality only a very small portion of the vaginal skin is treated in any one treatment. So most patients describe the treatment as a vibration. So they can feel the probe going in, but once the laser energy is delivered, it just feels like a vibration.
Yep.
Some patients get a small sting right near the end of the treatment, but that really tells us we're at the end of the treatment.
Yep.
Only lasts for a half a second or a quarter of a second, and then it's gone.
Yep.
And that's the end of the treatment.
Fantastic. Well, thank you very much. Don't overlook this. It's an amazing treatment. So thanks so much, Matt, for taking the time to talk to us today.
My pleasure.
Thank you. If you want to find out more about the Monalisa or see who actually offers this device around Australia, just log on to, just drop us an email at info@plasticsurgeryhub.com.au. Thank you very much.
My pleasure.